Now we'll be talking about diagnosing the psoriatic arthritis, that is the arthritis that is related to psoriasis. Now, the criteria which we have is called Caspar criteria, and it includes giving points to the presence of the point or presence of history. And the most important point is if the patient currently has psoriasis, then it is given 2 points. So presence of psoriatic plaques, presence of psoriatic lesions, if they are currently present in the patient, we give a score of 2. If the patient doesn't currently have any psoriatic plaques or the typical lesions of psoriasis, but patient earlier had the symptoms of psoriasis, then we give a point of only 1. We don't give 2 points. If the patient has family history of psoriasis, then we again give 1 score to the patient. Presence of dactylitis, that is presence of completely swollen complete finger, that is very typical of dactylitis. It is difficult to diagnose dactylitis. Very few doctors usually document presence of dactylitis, where you can see the swelling of not only PIP or DIP, usually the whole finger will be of swollen size. So if there is dactylitis, then the score given is 1. One of the most important finding is juxta-articular new bone formation, which can be evident on X-ray. This X-ray finding of a new bone formation around joint or around the typical joint, what we call it as juxta-articular new bone formation, which can be hazy, blurry around the joint, and this can be seen on X-ray. If this sign is present, we give a score of 1. Presence of negative rheumatoid factor is given 1 point, and presence of typical nail changes of psoriasis, that is either patient should have nail dystrophy or typical nail horizontal ridges on the nails, or onycholysis, that is destruction of this nail, or removal of or damage to the nail, that is onycholysis, is one of the typical sign of psoriatic arthritis. So if the patient has one or more finding of this, they are given points. Presence of 3 or more than 3 points, we can directly label that this patient has psoriatic arthritis if this patient fulfills 3 or more than 3 points among discussed. Thank you.